So good morning, everybody. I'm Dr. Amy Nguyen. I'm one of the urogynecologists. Urogynecology is basically a combination of urology and gynecology. And so basically the patients that you guys are going to deal with me on the floor have usually had some kind of incontinence or prolapse surgical procedure done. So what we're going to review today is how to do a voiding trowel. So materials that you're going to need, the patient is already going to have a catheter in place, and then you're going to need a 60 cc TUMI syringe. You'll need a 10 cc syringe to deflate the catheter, remove the catheter, and then you'll need a cross clamp, and then you'll need either sterile water or normal saline, whatever you have on the floor. Okay, so the instructions say, usually they'll say, after I've removed the vaginal pack and their pain is adequately controlled, and that part's important. So usually they'll say dose them with some kind of pain medication like an hour prior to you deciding to do the voiding trowel, just because if they're in a lot of pain, they won't be able to relax to try to urinate. So dose them up with pain medication. Then, when you're ready to do it, basically what you're going to do is you're going to fill the bladder back up with water. So it's almost like you're going to fill up the bladder and then you're going to take out the catheter. So you're going to take your 60 cc TUMI syringe, and then I want you to drop either between 200 to 450 cc's of either sterile water or normal saline. And you're going to basically put it back into the bladder. And so the most important part is make sure you're doing it through the right port. So this is the most common mistake, is that nurses will put it they'll inflate the balloon instead of the main port, and then it explodes inside the patient's bladder, and that would be really bad.
Yeah.
And so basically you're going to have to detach it where it's attached, and it's almost like you're flushing the catheter, basically, right? So you'll detach the bag from that main port and cross clamp it so that all that urine doesn't come flushing out on you.
Yeah. You only do it once.
And then slowly, you're basically going to put water back into the bladder, right? So then you're going to release it, and then you're slowly going to fill. Slow is important, because if you fill them up too quickly, they're going to be like, oh, I'm full, and they've only had 50 cc's put in. And so my goal is, again, to put anywhere between 200 to 400 cc's.
What would determine that?
The patient.
Oh,
so they're going to
okay.
tell you when they feel full. So you're going to fill them, and you're going to continuously fill them. So you would push in that 60 cc's, drop, again, keep filling until the patient says, all right, I feel really full. Then you'll cross clamp that main port. So actually you want to cross clamp this portion, right? So that, because you want to leave this portion open so you can actually deflate the Foley balloon. So if you cross clamp both, you won't be able to draw out the fluid to deflate the Foley balloon. Okay, disconnect, deflate the Foley balloon, so you should get 10 cc's out there, and then take out the catheter altogether. So you know how much you've filled the bladder, and now you've taken out the catheter. They have 30 minutes to try to urinate. No more than 30 minutes. I don't care what the patient says, no more than 30 minutes. If they can't void, then you're going to straight cath, and you'll call me with those results. If they can void, then have them void into a toilet hat. You'll measure how much urine comes out, scan their bladder, and then call me with those results. So regardless, you're going to call me immediately after the voiding trial. If they can't pee again, you'll straight cath. If they can pee, measure how much comes out, and then scan and see how much urine's left behind. Now, let's say hypothetically, you put in 300, they urinate 150. And you call me with those results, and you say, she urinated 150, I scanned her, she's got 150 left. Then usually what I'll say is straight cath them, and then I'm going to give them 3 hours to try to urinate on their own. So I usually give them 2 chances. My goal is I want them to urinate at least 70% of what you put in. And so, you know, if they're filled 150, or if they urinate 150 and there's 150 left behind, then they've only emptied 50%. And then I'll say, they'll probably need to go home with a catheter, but let's give them a second chance. So I'll say straight cath them, and then let's start the clock over. 3 hours. We'll see how they do on their own, just drinking water, and then measure how much comes out, and then scan and see how much is left behind. And then during those 3 hours, I don't want them drinking a ton, so usually I'll say, okay, 2 glasses, like 2 8-ounce cups of whatever. But if you get that bladder too distended, they won't be able to urinate. So, but when you call me, I'll review with you what I want you to do based upon whatever the numbers are. Okay. Questions about that at all? Anything? So again, most confusing part is you really want to make sure that you fill through the main port, cross clamp the main port, not both, and then deflate the Foley balloon. And fill slowly. I think that's the most important part. And then sometimes you're like, okay, you get to 150 and they're like, oh my God, I'm so full, stop. And I'd say, okay, let's just wait a couple minutes, kind of let that bladder spasm die down a little bit and see if you can get an additional 50 cc's in. To at least get them to 200.
Slow is key.
Yeah, absolutely. And if they have to go, if they're not able to urinate or if they have to go home with a catheter, then usually I explain to them, sometimes there can be a lot of swelling in the tissues after surgery, which prevents them from being able to empty completely. And then they'll need to go home with a catheter. They'll go home with a catheter for 1 week. They'll schedule an appointment to see me in the office 1 week. They'll repeat the test at that time. And like 95% of the time, 99% of the time, the catheter comes out in 1 week.
Okay, good.
All right. All right. Very good, guys. Thank you all.
Awesome.
No,